Not long ago, I met a 68-year-old man whose case I still think about today. He did everything right, every medication on time, every instruction followed. He was careful with his diet, he paid attention to his health, and yet his blood pressure was still dangerously high. There was no obvious reason for it. Nothing you could point to and say this is where things went wrong. But something was, and the part that stayed with me was this. The thing that was quietly making his condition worse every single day was something he was using without question, something he believed was completely harmless. It was in his kitchen. Now I have seen this pattern more times than I can count. People trying to do the right thing, following advice, staying consistent, and still moving in the wrong direction without realizing it. Because after the age of 60, blood pressure does not just rise because of salt or stress. Something deeper begins to change inside the body. Your blood vessels are not as flexible as they used to be. They do not respond the same way. And when that change happens, even normal blood flow starts to create more pressure than before. And behind that change, in many cases, is something you cannot feel at all. A slow, silent process building up over time. I am Dr. Javier Morales, and after decades of seeing what happens when this goes too far, I can tell you this. Most people are focusing on the wrong things. In this video, I'm going to show you 7 simple changes that can begin to shift this in the right direction. No complicated routines, no extreme diets, just practical things, many of them already in your kitchen. That can make a real difference when you use them the right way. Stay with me, because by the end of this video, you will not just understand what is happening inside your body, you will know exactly what you can start doing tonight. If you walk into your kitchen right now and open the cabinet where you keep your cooking oil, there is a very good chance you will find something that looks completely normal, something you have probably used for years without thinking twice about it. And yet this is where I often start when I look for what is quietly driving blood pressure higher over time. Because not all oils behave the same way inside your body. Many of the most common ones, the ones labeled as heart healthy for decades, are heavily refined and extremely high in omega-6 fatty acids. On their own, that may not sound like a problem. Your body does need some of them, but the issue is balance. When that balance shifts too far, something begins to happen beneath the surface. A kind of low-grade irritation that does not cause pain, does not send a clear signal, but slowly affects how your blood vessels function. Over time, they become less flexible, less able to respond. And that is where pressure begins to rise in a way that feels almost invisible until it is not. I have seen patients make no changes to their medication at all, but simply change what they cook with. And within a few months, their numbers begin to move in the right direction. Not dramatically overnight, but steadily. Sometimes the most important step is not adding something new. It is removing what has been working against you all along. And then there is something even simpler. Something so small that most people dismiss it the first time they hear it. The order in which you eat your food. Most people sit down and reach for whatever is closest. A piece of bread, a spoonful of rice, a bite of something easy. It feels natural. But what happens next inside your body is not as simple as it seems. When carbohydrates hit your system first, your blood sugar rises quickly. Your body responds by releasing insulin, and that response has an immediate effect on your blood vessels. They tighten, just slightly, you do not feel it, but it happens. Now imagine that happening meal after meal every single day. The pattern builds. I have had patients change nothing about what they eat. Same meals, same portions, same routine. The only difference was what they chose to eat first. Vegetables before anything else. Something interesting happens when you do that. The fiber begins to slow everything down. The rise in blood sugar becomes more gradual. The response inside your body becomes calmer. And over time, that small shift starts to show up in ways people do not expect. Not because the food changed, but because the way the body experienced it did. There is something else I often find sitting quietly in people's kitchens. Most of the time, it has been there for years, used occasionally, not taken very seriously. Apple cider vinegar. If you have heard about it before, there is a good chance you are also a little skeptical. Most people are. It sounds too simple to matter, and that is exactly why it is so often overlooked. But inside your body, something interesting happens when you use it the right way. Not in large amounts, not as some extreme routine, just a small consistent addition. After a meal, your blood sugar naturally begins to rise. That is normal, but when that rise is too fast, your body reacts quickly. Insulin increases, and that reaction affects your blood vessels in ways you do not notice in the moment. They tighten, just enough to increase pressure. Now imagine that happening several times a day, every single day. Over time, it adds up. What apple cider vinegar does is not dramatic, but it is meaningful. It slows that rise. It helps your body respond more smoothly instead of reacting sharply. The difference is subtle at first, but with consistency, it begins to change the pattern. I usually suggest something very simple. 1 to 2 tablespoons diluted in a glass of water, taken with a meal. Nothing more complicated than that. It is not a quick fix, but it is a steady one. And then there is something most people never think about when it comes to blood pressure. What happens while you are asleep? During the night, your body is supposed to shift into a quieter state. Your heart should not be working as hard. Your blood pressure should naturally come down, but for many people, it does not. It stays elevated, or worse, it rises without them ever knowing. I have seen patients with perfectly acceptable readings during the day, only to discover that their bodies never truly rest at night. And over time, that constant strain begins to show. This is where a very small habit can make a surprising difference. A handful of walnuts, about 30 grams, eaten not long before going to sleep. It sounds almost too simple, but walnuts contain a combination of nutrients that gently support the body's ability to relax at night. They help your blood vessels ease instead of staying tense. They support a more natural rhythm, the one your body is supposed to follow. Nothing dramatic, nothing you would feel instantly, but over time it creates a different environment inside your body. And that is often where real change begins. There is a drink I sometimes mention to patients that surprises them the most, not because it is rare, but because it has been around for a very long time, used in different parts of the world, long before modern medicine began studying it closely. A deep red tea, slightly tart, almost like cranberry. Hibiscus. At first it does not sound like something that could matter, just another herbal tea, something light, something optional. But inside the body, it interacts with your blood vessels in a very particular way. There are compounds in hibiscus that influence how tightly or how loosely your blood vessels behave. Not in a forced way, not in a sudden drop, but in a gradual, steady shift toward relaxation. I have seen people incorporate it into their daily routine, almost casually. 1 cup in the morning, another later in the day, maybe 1 in the evening. Nothing complicated, and over time their numbers begin to reflect that change. Not because of one single cup, but because of the consistency. That is something I come back to often. The body responds to patterns, not isolated moments, and the same idea applies to what happens right after you eat. Most people finish a meal and sit down. It feels natural. You have eaten, so now you rest. But inside the body, that is one of the most active moments of the entire day. Blood sugar begins to rise, hormones shift, blood flow changes, and when the body is completely still, during that process, everything happens a little more abruptly. The rise is sharper, the response is stronger. Over time, that pattern repeats. Now imagine something slightly different. You finish your meal and instead of sitting, you move. Nothing intense, no workout, just a slow walk. 10 minutes, maybe 15. Something very simple begins to change. The body handles that post-meal rise more smoothly. The increase in blood sugar is less dramatic. The response inside your blood vessels becomes more controlled, less reactive. It is such a small shift that most people underestimate it. But I have seen how those small shifts repeated every day begin to reshape what is happening internally. Not in a way you feel immediately, but in a way that shows up over time quietly, steadily. And that is often how real progress looks. There's one more thing that almost no one pays enough attention to, not because it is complicated, but because it feels too ordinary to matter. Water. As we get older, the body's signals begin to change. The feeling of thirst becomes less reliable. People drink less without realizing it. And over time, that quiet lack of hydration begins to affect how the body functions in ways that are easy to overlook. When there is not enough fluid in the system, the blood becomes more concentrated. It does not move as easily. The heart has to work a little harder to push it through vessels that may already be less flexible than they used to be. It is subtle, but it matters. And when I think back to that man I told you about at the beginning, what stays with me is not just how his numbers changed over time. It is something he said to me months later. He looked at me and said, "I wish someone had told me this earlier." That moment stays with me. Because in my experience, after all these years, it is rarely one big mistake that leads people here. It is a collection of small habits repeated every day, quietly shaping what's happening inside the body. And the same is true in the other direction. It is not about doing everything perfectly. It is about changing the direction one decision at a time. If you take anything from this, let it be simple. Do not try to change all 7 things at once. Choose one, just one that feels easy enough to start tonight. Because real change does not come from intensity. It comes from consistency. And I have seen again and again how even small adjustments can begin to shift blood pressure in a meaningful way when they are done consistently and alongside proper care. That is my perspective, not just from research, but from years of watching what actually works in real people. But I also want to be clear about something important. Everything I have shared here is general information. It is based on current understanding and clinical experience, but it is not a replacement for your personal medical care. Do not stop or change any medication without speaking with your doctor. Bring these ideas into that conversation. Use them as support, not as a substitute. Your doctor is your partner in this. Your body is still responsive, even now. And the decisions you make starting today still matter more than you think. Take care of your heart. It has been working for you every single moment of your life. It deserves the same care in return.